So what I'm going to do today is I'm going to show you some massage techniques that can be done on a clothed client in a chair. And this is Beatrice. She's going to be my model today. And we're going to be focusing on the neck and shoulders, and the muscles are going to be the trapezius muscles primarily, which is going to be attaching onto the skull, on down to the scapula, and then they also go into the back. And then when we get to the back here, we're going to also focus a little on the rhomboids and the muscles that are beneath the rhomboids, which are going to be the paraspinals. So what I like to do is I like to just start with just taking your hands, fingers in the front, thumbs in the back, and just taking a moment to take a few deep breaths and inviting the client to do the same. Because there is kind of a trade secret in massage that you can't give what you don't have. So if I'm trying to relax the client, I have to be relaxed myself. So then what I'm going to do is I'm going to take my hands, I'm going to squeeze them together, and when I'm squeezing them together, I'm actually pulling up the trapezius, the top part of the trapezius, into my hand. Now, as I'm doing this, I'm going to be kind of checking out what's going on left to right. And so this lets me know what I need to be focusing on when I really dive into the massage. Okay. So then after a few moments of this kind of movement, and again, I'm making this kind of clamp with my hands, then I'm going to switch to thumb pressure on the back and finger pressure on the front. And as I'm pushing into the tissue, I'm creating this rolling movement, this rolling friction movement. And I'm really getting in not only to the traps right now, but I'm actually getting in to one of the rotator cuff muscles called the supraspinatus. And take your time and just, you're going to focus on areas that feel kind of tight, or I like to use the word sinewy whenever you're finding these hot spots. And another thing that you can do is you can isolate a point by just applying direct pressure. I want you to notice that my pressure is about a 45-degree angle. Most massage techniques are done at a 90 or at a 45-degree angle here. And notice how I'm keeping my thumb relatively straight, okay? As opposed to like this. This is gonna be a proper technique here. And you can do moving pressure, or you can do static or still pressure like this. And it's interesting, but she is a little more congested or tight on her right side, so it automatically, I'm spending much more time on the right compared to the left, okay? Now, and then what you can do is you can go up to the neck. Now, when I'm going up to the neck, I want to use an anatomical model to show you what I'm doing. It's called the mastoid process, You have one on one side, and I'm going to turn the skull over, and you have one on the other side here. And what you see, this line that connects this mastoid process on the temporal bone to this other mastoid process, we call that there's a couple names for it, the occipital ridge or the suboccipital space. And we're going to be applying, there's a lot of muscle attachments here. This was a painted skeleton. You would see blue and red marks all around it, and those would stand for muscle origin insertion. So what I'm going to do is I'm going to be taking my thumb, pressing it into those attachment sites, and rocking her head back onto my still thumb. The thumb is going to act like a fulcrum point. So if we apply that technique and that visual to Beatrice, here is her mastoid process right here. I'm going just beneath it. You can kind of see the tissue part here. And then because I don't want to put my hands on her throat or anterior neck, I'm just going to curl my fingers behind my extended thumb. And then I'm going to take her forehead and I'm going to gently rotate her, not really rotate, tilt her head back onto my thumb like this. And you want to hold it for a minute, and you release the pressure. And now remember, I'm moving to the next point now. Holding, tilting back. How does that feel? Okay? Okay. Want to do the next one. On a scale from 1 to 10, how much pressure do you think I'm pressing? 5, okay. 5's a good number. You never want to get past a 7. Now you can do rotating pressure or cross fiber pressure like this. How's that feel? Okay, nice, good. to try to release those points, those tender points that some people call them trigger points, some people call them acupoints. They're all right. And if I'm ever hurting you, I want you to tell me to back up under pressure. And I want you to notice that communication I'm doing with Beatrice is a very important part of the massage technique. Now I'm going to work on the other side just for a moment, just to be sure you work on all sides. How you doing? Okay, good. And notice my body is pretty close to hers. You really can't do this at a distance. You want to keep your arms pretty close to your body. In fact, what I'm doing is almost glued to my sides. And that's actually a very good body mechanic principle. And if a client has a tension headache, these are fantastic points to work. Okay. So next I'm going to start working on the middle traps, the middle trapezius muscles. And so we've already worked the suboccipital region right here, and now we're going to go down the sides of the neck, and we're going to go down, and we're going to end up right here. And in anatomy, this is called the acromion process. And so what I'm going to first do is I'm going to apply that same technique, but instead on the suboccipital region, I'm going to go into an area called the lamina groove. The lamina groove is an area that is between the spinous processes and the transverse processes. And I know these are a lot of big words, but we're going to learn all this stuff in massage school. And in fact, my very favorite definition of massage is the study of anatomy in Braille. The study of anatomy in Braille. So part of what we're going to be doing in massage school is teaching you these bony landmarks, these bony markings, so you'll know where to apply pressure. So I'm in between one process that's here on the side, the transverse processes, and one process that's straight pointing posteriorly called the spinous processes. And right in between there is where the muscles live. That's called the lamina groove, and they're one on both sides. I'm focusing just on the right side right now. So on a scale from 1 to 10, pressure-wise, where are we at? A 6. Okay. Again, I'm happy with a 6. You happy with a 6? Good. Okay, so continuing going down. Now, once I get to where the neck ends and the shoulder begins, I'm going to start going pressure downward instead of across. Okay. And right on top of that trap. And her shirt actually doesn't have a seam at the top, but if the shirt did, I would just lay it down on that seam and I would press right into that seam. It kind of gives me a little bit of a direction to go. So we just worked on one side. You can do the same thing on the opposite side, into the lamina groove. This is a little tighter over here. You feel that? Yeah. And again, tension is something you can feel, you can detect, especially when you can compare left to right. So if she were my client, I would recommend a table massage after the chair massage, because sometimes this is actually a really good place to start a massage. You can kind of figure out what you're going to do when you get to the table. Some people call the chair massage a tune-up and the table massage an overhaul. It's kind of fun. But yeah, this side is a whole lot different. Again, if I'm hurting you, tell me, okay? You want to hurt good, but not hurt like, We call it to the pressure pain threshold, not beyond the pressure pain threshold. I think what I'm going to do, I'm going to pause here. Again, I'm taking my cues from my client. Put your head this way. I'm just going to stop a second and give a little extra work to this side. So again, fingers in the front, thumbs in the back. You can also use this Body Workers tool, your ulna. Put it, get your hair. How does that feel? Yeah, see, smiling, good sign, good sign. This also gives your hands a break by using your forearms. Very good, very, very good. Come back to center. Very good, okay. You feel any better? Very good. And if you can, it's hard to see, but the skin is a little redder on this side right now, which is actually a very good sign. That means the superficial blood vessels are dilating, and we call this hyperemia, the hyperemia. Now, once you get the suboccipitals worked, the lamina groove worked, the top of the traps work, you can ask them to use their elbows and lean on their thighs a little bit. Right there's perfect. And then you can apply that same strategy down the back. And the trapezius makes this V, and it ends up at the last thoracic vertebra called T12. And again, you can either use your thumbs to press into that lamina groove, the same place. Now you're going to lose the ability to feel the transverse processes, so you're going to rely mainly on your knowledge of anatomy, which is where the spinous processes are. And your thumbs are going to be about 1 inch from the spinous process, or 2 inches from each other. And again, focusing down, I want you to notice that as I'm moving down, I'm stepping back a little bit to keep my body mechanics in line. How's the pressure? Okay? Okay, very good. Or I could use my elbows. I'm not going to, but I just want to show you that is an option available to you. And notice she's having a kind of counterbalance. Did you notice that? If without this, she would just fall over. So you want her to kind of give some of that counterbalance. And this is when I'm working on not only the traps, but also the rhomboids. And as I get down beyond the 6th thoracic vertebra, or T6, I'm now actually into the lats, the latissimus dorsi. And again, we spend a lot of time going over anatomy. I would say over half the program in massage school is going to be about anatomy, physiology, and pathology. Because again, the definition of massage is the study of anatomy and Braille.